Good afternoon, and thank you for joining us today. On today's briefing, we'll hear from Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, Chantel Jewell, Milwaukee County House of Corrections Superintendent, and Darren Rausch, Health Officer and Director with the Greenfield Health Department. Mayor Barrett, I'll hand it over to you to get us started.
Well, thank you very much, Catherine, and good afternoon, everyone. I want to spend a couple minutes just talking about the American Rescue Plan, because I think as we get closer to May 11th, May 12th, when we are expecting the guidance from the Treasury, we continue to do our internal deliberations as to how we can best use this unprecedented infusion of dollars. And when I say unprecedented, just to put this in perspective, the city of Milwaukee will receive approximately $406 million. Milwaukee County over $180 million. There have been reports that the Milwaukee Public Schools would get in the neighborhood of $700 million. And on top of this, of course, the state of Wisconsin will be receiving $3.2 billion. So by any measure, we are going to have a significant infusion. And I would go as far as to say well above $1 billion injected into the Milwaukee economy between now and December of 2024 to deal with COVID and to deal with the ramifications of COVID. Not surprisingly, the first place that we're looking, and I'm sure the other units of government are looking as well, is at replenishing those programs and those coffers that were hit severely by loss of revenue due to the pandemic. That means loss of revenue that the city had, the county had, and we are continuing to work with our budget office so that we can present that to the Common Council, which would be the first money that we will receive. We anticipate we will receive the first $200 million or so sometime in the second or third week of May, which is again when we're planning on getting the infusion of dollars and the guidance from the Treasury. But beyond that, we think there are other opportunities for the city, for the county, for the schools, for the state, to address not only the pandemic, which we clearly will spend a significant amount of money on the pandemic and the healthcare costs, but other costs that we are incurring and other opportunities for us to address some of the inequities that have led to a very disparate impact on people of color in particular, and others who don't have the insurance or don't have the ability to get what they need to fight off the pandemic. So we expect additional direction from the federal government on how to use that money, and we will obviously keep everyone up to date as to what we are doing there. A lot of news earlier this week with the announcement by President Biden and the CDC about masks in public. The Milwaukee Health Department is continuing to have internal discussions about the current mask ordinance. I just got my first briefing earlier this week from the commissioner about the concerns and the opportunities there. They are working through the Common Council process. They've been meeting with stakeholders, various stakeholders who, not surprisingly, have strong opinions one way and another as to how we should go forward with the mask ordinance. But people should know that as the current ordinance stands, there is no enforcement of outdoor masking in public spaces, and an update to the ordinance would not change that. And I'm talking specifically about things like outdoor dining, not talking about events at the ballpark or mass gatherings, but at those outdoor spaces where people in smaller numbers are gathering. So stay tuned on that. We're continuing to work through the Common Council process on that. And I don't have any more news on that right now. I do want to have an update on the gating metrics, and Dr. Weston probably will touch on a lot of this as well. But since it is Thursday, I want to provide an update on this week's gating metrics. We remain in the high transmission category for the number of COVID cases per 100,000, just as we were last week. But fortunately, our numbers have decreased from 127.1 to 111.3 since last week. Our percentage positive for cases remains in the moderate transmission category, but again, we're headed in the right direction, slightly down from 5.8% last week to 5%. These slight decreases are promising to see, and I want to see more, and I want to continue to see this downward trend in COVID transmission in our community. In order to continue on this positive track, we need to continue to wear the masks when warranted, wash our hands and watch our distance. We also need to continue seeking testing for symptoms. or when exposed to COVID positive individuals. And we need to continue to seek vaccinations as a tool in our fight. And of course, I do want to touch on vaccinations because I don't want to take my foot off the accelerator when it comes to vaccinations. I am very much of the mindset based on public health that the more people who have the vaccinations, the healthier our community will be and the faster we'll be able to return to life as normal. So because of that, the city continues its commitment to offer quick, easy, and free vaccinations for Milwaukee residents at the Wisconsin Center and Northwest and South Side Health Centers. In fact, just this morning, I was at the South Side Health Center and I was pleased to see the number of individuals at the South Side Health Center getting the shots. It was very, very heartening to see. They actually said it wasn't as busy as it has been, and that earlier, this is a good time of week to get it because they're a little busier on Mondays and Fridays. So again, if you have an opportunity, take advantage of that. This Sunday is the final Sunday for vaccinations at the FEMA mass vaccination site at the Wisconsin Center, and walk-ins will be accepted from 9 a.m. until 3:30 p.m. I want to stress that the vaccination changes at the mass vaccination site are in part due to the very proactive approach that our health department is taking, getting the vaccines into the neighborhoods. We continue to do everything we can, and I'll talk about that in a minute, to get the vaccines in the neighborhood. But going forward, the Wisconsin Center will be open Monday through Friday from 9 a.m. to 5:30 p.m. and Saturdays from 9 a.m. to 3:30 p.m. So we're still open on Saturdays and certainly during the week. As of today, the vaccination rate for Milwaukee adults who have completed the vaccine series is 30.8%. All right, we cracked 30%. And again, let's go higher than that. We're making progress, and I want to keep seeing us move forward in our vaccination efforts. So in addition to the sites that I talked about at the Wisconsin Center, the Northwest side, and the South side, we are continuing our efforts in the community to bring vaccine to the people. And so here are a couple events for the remainder of the week. Today, Pastor Mary Martha Canas of Hepatha Lutheran Church, located at 1720 West Locust Street, will be offering vaccinations to the public from noon to 4 p.m. Tomorrow, and this is one that I think is very, very important, tomorrow, April 30th, the Mexican Consulate, which is located at 1443 North Prospect Avenue, will be vaccinating individuals from 3 to 5 p.m. We've had a great relationship with the Mexican Consulate, and for those individuals who might have reservations about going to one place or another, but have ties to the Mexican Consulate or feel comfortable there, please take advantage of that. And again, another very important partner to us in the Latino community, on Saturday, May 1st, Voces de la Frontera, located at 733 West Historic Mitchell Street, will be offering vaccinations from 10 a.m. to noon. So as you can see, we're taking the vaccines to the people, and we're doing that because we know that it's important for us to reach people where they are, and that's something we're very much committed to. So I appreciate the partnership with the county. I appreciate the partnership with the state and the federal government, and I appreciate all the help that Dr. Weston has been. So I will turn it over to Dr. Weston right now. Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we're currently seeing an average of 124 new cases a day and about 2 deaths every 3 days. We did see a decline in vaccinations per day from about 8,600 a day last week to 7,200 per day this week. We do continue to see gradually improving trends with respect to our case numbers and our positivity rate, and we've had stable hospitalizations. Transitioning to the vaccine, when I see patients in the emergency department, I often ask them about the COVID vaccine. That might not be surprising. I asked whether they've received it, and if not, what questions they have about it. So from those who've not yet received the vaccine, I often hear that they're concerned about long-term side effects from the vaccine. They say, and I think reasonably so, that the vaccine has only been around for less than a year. How can we know whether it's safe in the long term? And I think that's a fair question. How can we guarantee what effect the vaccine will have 10 years down the line after taking it? And of course we can't, as it hasn't been around that long. But what we do know and what we can lean on to answer this question is the facts of how the vaccine works. Now, there are different types of vaccines. They have slightly different mechanisms, but they all work the same fundamental way. Once the COVID vaccine is in your body, just like any vaccine, its job is to train your body, train your immune system to recognize the COVID virus so that when that virus someday enters your body, you can fight it off. Just like your body does countless germs that enter your body every day. Now, what's key is that after the vaccine trains your immune system, it's gone. It's broken down and it's gone. And that is why the long-term negative effects from the vaccine would not be expected. It's designed and it's rigorously tested to be in your body for a very short time. It does its work and then it leaves. Now, that's not the case for the COVID virus. Much like many other viruses we see, COVID enters your body and stays for a longer time, at least a week and perhaps much longer. It causes short-term symptoms that we've all heard about, mild in some, much more severe in others. But in many, about 1 in 3 people, it causes longer-term symptoms. And even in young people, 18 to 39-year-olds, 1 in 4 people have long-term symptoms. Now, these long-term symptoms from COVID can be very bothersome symptoms: headaches, trouble breathing, body pain, fatigue. But they can also, in many cases, be dangerous and potentially deadly with autoimmune-like conditions in children, like multisystem inflammatory syndrome. Long-term inflammation of the heart has also been seen in as many as 60% of people. Long-term decreased lung function has been seen in as many as 70% of people who are hospitalized with COVID. And neurologic dysfunction, whether headaches, seizures, other issues, has been seen in many people with COVID long-term as well. Now, these are the discussions that I have with my patients. As with any medication, any procedure, any surgery, there's risks and benefits to consider before proceeding. And often, in a lot of cases, in a lot of these discussions I have, the risks and the benefits compete. They're close, and the decision whether to proceed is really difficult. With the COVID vaccine, there's really no competition. Whether short-term effects or long-term effects, there's no comparison. The data from the studies of tens of thousands of people who went through the trials and the accumulating information from the more than 140 million people in the United States who've received the vaccine is overwhelming. The vaccines are safe and they're effective, and the risks and benefits of getting the vaccine far outweighs any risks or any benefits of getting the virus. Whether you're a 90-year-old with many medical problems or a 25-year-old and the picture of health. And on top of that, getting a vaccine is easier than ever right now in Milwaukee County. You can go to healthymke.com to find a vaccination site near you. Thank you, stay safe, and I'll hand it to Greenfield Health Director Roush.
All right, good morning, or good afternoon, everybody, excuse me. A lot of sorts today. Good afternoon, it's my pleasure to join today from the City of Greenfield Health Department. Just wanted to start before I launch into the data today to talk about some overarching comments. We have heard some great news and we've heard some not so great news today about disease, about cases, and about vaccination. And certainly today I want to start off my comments talking about COVID disease in our community. And excited to say, after about 4 or 5 weeks of continuing to say slight increases, we are seeing some positives in the data. And those positives are showing a plateauing to maybe even a slight decrease in the data over the most recent days. However, as we dig into the data, as always, we are seeing a few areas where we're seeing some increases, especially in children. So as we think about that data about children, we are seeing a very pronounced increase amongst children in the city of Milwaukee. And primarily it appears that it's in the 15 to 17-year-old age group and even the younger adolescent age group as well. And we'll dig into that data momentarily. So let me go ahead and share my screen and we will take a deeper dive into the data for today. So what you see before you on the screen today is the Milwaukee County total population daily number of new cases. And again, here, if we focus in really carefully on these last 7 days, we are seeing a plateau kind of across the county. We're seeing a plateau in the city of Milwaukee, and we're seeing a slight decrease in the suburban communities. So a plateau in this case, I would consider a positive, but certainly the details of this when we flip to the kids report, which I will do now, shows a little bit different story. So this is the kids report looking at new cases of COVID disease amongst kids. And we can see that largely in the city of Milwaukee, this orange line, the 7-day average has been increasing since about the middle of March, increasing a little bit of a dip here and continuing to climb. In the suburban communities, we see a little bit more of a plateau, but then a slight increase, and even more recently, a little bit of a decrease. So this is something we want to watch very carefully. Disease in children, while it might not be significant and it might not lead to hospitalization, disease in children can bring disease into homes, and it can put adults and grandparents and others at significant risk for severe COVID complications. Sticking with the children report, this graph here looks at children under the age of 17. It excludes the 18-year-olds. And again, we're seeing a very similar story, no matter how we slice that, either 17 at the cut at 17 or the cut at 18 years of age. When we look at confirmed cases further by some of the demographics, this is where I think it gets a little bit more interesting. And this is where I think we can hone in on which age group is leading to some of this increase. And while we've seen kind of a noticeable increase since the middle of March across all of the age groups, it seems that the directionality is a little bit more significant and a little bit more increased in the 15 to 17-year-old population, this one, and a little bit here in the 12 to 14. So again, we want to watch this very, very carefully. And as you heard me say last week, in the whole population, as well as the kids, if we look at the bottom left here at race and ethnicity, the increase in our Black and African-American population subgroup has increased more rapidly than any of the other population race and ethnicity subgroups, looking here. So this is something that we want to pay specific attention to and continue to work in those communities to get the word out, increase vaccination, increase the use of the 3 Ws, increase distancing, and make those connections. Over the last few weeks, we've talked a lot about hospitalization rates among children. And while these mirror what we see in the general public, certainly we had some alarm a few weeks ago at looking and hearing some of the national stories about younger individuals and children being hospitalized. So we reflect a little bit of a spike in hospitalizations this week, to 5 hospitalizations over 1 or 2 in the previous weeks. And so again, something that bears note. Disease might be less severe in children, but certainly the disease and the disease variants might be causing and leading to more disease in kids that is maybe more severe. All right, so going back to the whole county report, we see that death numbers, as Dr. Weston has reported, are essentially non-existent in our adult population, which is very favorable, and a trend that we certainly weren't seeing through October, November, and December, and even in the early days of the pandemic a year ago. The growth rate or the transmission reproductive number is something we've talked about previously. When we look at this, we want to see disease suppressed and we want to see that transmission rate below 1. And I'm happy to report that over the last several days, that transmission rate is below 1, which means that we're stopping and slowing the spread of disease. But certainly when we look at this at a little bit more granular level, we see that the patterns in the city of Milwaukee on top are a little bit more different and hovering around 1 more so than the suburban communities, which are significantly below 1 at the current time. So again, something that we want to be very cognizant of and cautious of. We've talked about testing a lot in the past, folks. There's testing and there's testing availability wherever, in many places throughout the community. And if you need to be tested, please do so. We've seen a slight increase in testing over the last few weeks, which is probably related to increased transmission recently. And again, we want people to get tested to know their disease status if they've been exposed or if they're concerned about their disease status. And so with the increased testing and with some of the slower transmission and more of the plateauing, we are seeing some favorable trends. We're seeing a little bit flatter 14-day trends. We're seeing some flattening on the daily percent positive. Again, something that's very favorable and something that we can look at positively in the data. Lastly, today I want to target and look at the spatial map of where cases have been occurring over the last 2 weeks. Again, consistent with the case rise I've talked about within the city of Milwaukee, and specifically in the African American community. We see a lot of activity, a lot of disease activity through the north and northwest part of the city of Milwaukee, but we're also seeing other areas of high activity on the south side and in some of the southern suburbs. So we want to continue to stress the importance of the 3 Ws, the importance of vaccination, and encouraging others in your life to talk about and get vaccination. So I'm going to stop sharing here quick and pull up some information that I had created and to talk about some of the masking orders and some of the masking guidance that we've seen recently. And this is really important because some of that guidance can be confusing. I will readily admit that it is sometimes hard to follow some of the CDC guidance. So I want to share with you a couple notes that I put together. We have been using masks. We've been doing physical distancing, social distancing. We've been washing our hands for a long time. We've been doing this for about almost a year, a little over a year. And the importance with learning more and understanding more about COVID and getting vaccination numbers and getting those vaccination rates to increase means that we can start lessening some of those restrictions. So I'm happy to report, and certainly we've heard earlier in the week in media briefings, that the Centers for Disease Control and Prevention changed their guidance on masks. And this guidance reflects new and advancing knowledge about the effectiveness of both the vaccine, but also the transmission of COVID disease and the transmission of COVID disease among those who are vaccinated. These changes follow the ever-evolving science of the topic, and we continue to learn more about COVID-19 every day and every week. And with that said, I would certainly anticipate further changes in the future. At this time, the CDC's changes for masks were for individuals who were fully vaccinated. And the CDC documentation on their website addresses both indoor and outdoor environments and provides some guidance and some strategies and some flowcharts to help the public think about when they should mask. In general, as we've discussed previously, outdoor events are safer, and they're going to be generally safer as long as they're not overly crowded and they provide for some opportunity for physical and social distancing. Indoor environments, offices, homes, etc., permit unmasking in certain situations if all persons are fully vaccinated. And this would include 2 families where both couples are fully vaccinated, and maybe also even an office environment where everybody is fully vaccinated and their vaccine was received more than 2 weeks ago. In other settings, wearing of masks continues to be the safest and most appropriate option. And I like to think about it with this phrase that I found on social media. So all credit is not given to me. All credit goes to a random person on social media that stated in the comments to a particular flow chart about should I wear a mask. It was, if you have to ask, just mask. So if you have to ask, just mask. If I'm out and about in my community, in an outdoor social setting, on a walk with the family in the park, and it's not crowded, as a vaccinated person, I don't have to wear a mask. But if I'm in a crowded space, a concert, a Major League Baseball game, I will be wearing that mask. Similarly, in my home with vaccinated persons from outside of my family, I don't have to wear a mask. But if I'm at work, working with the public, working with people from other departments who I don't know of their vaccination status or they're unvaccinated, I'll be wearing that mask to keep myself safe and to keep others safe. One last thing I want to share briefly is just this particular flow chart. And this was the flow chart I found on social media that I thought was just so great in thinking about, do I need to wear a mask or not? And again, that adage of if you have to ask, just mask is a great one. But think about it, if you're in an outdoor environment and you're with fully vaccinated people and you're not overly crowded, the bottom line is no, you don't have to wear a mask. And if that's encouraging to you to get vaccinated and that's encouraging for others to get vaccinated, please Share with them the healthymke.com site and other resources for finding a vaccination location. But in other settings, folks, we need to remember that masks are still very appropriate inside, indoor environments, work environments, and crowded outdoor spaces. And again, I realize and I understand that we all want to return to normal, but at this moment, masking remains one of those simplest personal responsibilities we can take to reduce the spread of disease in our community. We see it here on this flow chart with all accolades and attributes to USA Today, who had published this yesterday. It's important that we continue to take those personal responsibilities to keep ourselves safe, to keep our families safe, and to keep our communities safe. And also, continue to encourage others in your social circles, your family, your friends, your coworkers to get vaccinated so we can move closer to normalcy in the days, weeks, and months ahead. Thank you very much, and I'll now turn it back to Catherine.
Thank you, Director Rausch. We will now hear from Superintendent Jewell. Oh, you're on.
I'm sorry, I was muted.
Go ahead.
Thank you, Catherine. Good afternoon. Today, I'd like to share that today, Milwaukee County launched a new dashboard that shows key vaccination data for residents and employees at the House of Correction. This data reflects individuals who have been vaccinated at the House of Correction or elsewhere before arriving at the HOC. Because of space limitations, oftentimes in correctional facilities, physical distancing and other safety precautions are not always possible. Reporting on vaccination rates is one way Milwaukee County can be transparent and hold ourselves accountable for instituting our top defense against the spread of the virus, vaccines. Due to COVID-19, we've had to significantly reduce our programming and group activities for residents. Tracking and increasing vaccination rates will help us resume programming, which is so important for the physical and mental well-being of the individuals that are in our care. Paying special attention to this population and their needs is one of the ways that we can bridge the gap in health disparities along racial lines. This effort will help us to move closer to our vision of becoming the healthiest county in Wisconsin. The dashboard will provide a breakdown of total doses received and doses administered per week, the total number of doses the House of Correction has per week, the percentage of residents and staff who have received a full vaccine series, and metrics showing the number of residents and staff in the facility and the number of people on the vaccine wait list. Last week, 19% of residents had received the full vaccine series with 4 on the waiting list. This week, 22% of our residents had received the full vaccine series with 0 people on the wait list. For employees, last week, 43% of our staff had received the full vaccine series. This week, 44% have received the full vaccine series. The dashboard currently represents the last 2 weeks of data. It will be updated every week on Wednesdays. We wanted to share this information at this point, but please realize that this is just a starting point. As more information is made available to us, it is our hope that this dashboard will evolve and we will be able to provide a more detailed breakdown of information. Looking at the data we obviously recognize that there's more work to be done in educating and encouraging our residents and our staff to take the vaccine. Just like we're seeing locally and nationally, there's some hesitancy. Individuals have questions about vaccine. There's some fear, mistrust, and general apprehension. So we will continue to work and provide both written and video information to dispel some of the myths and equip our residents with information so that they can make informed decisions. The House of Correction has provided many materials in written and video formats, both in English and Spanish. Our health center staff is available to answer any questions and provide additional information. Our security staff is available to share their experience with the vaccine. We are also about to launch a more targeted outreach and culturally competent health education in the facility. Milwaukee County is amongst one of the first jurisdictions in Wisconsin to release a comprehensive vaccination data for individuals in custody. We are committed to making data-driven decisions. We have used and will continue to use this information to inform our policies, our practices to better serve those in our care, such as safely reinstating programs and recreational activities for our residents as vaccination rates increase. We are currently able to offer both the Moderna and the Johnson & Johnson vaccine at the House of Correction in order to give residents a choice. If an individual leaves Milwaukee County prior to receiving their second dose, there are a number of things that can happen. We always make sure they leave with their card and information for their next shot. Our health services staff can also schedule their next appointment at the Kosciuszko Community Center. We can provide transportation to and from this appointment. Individuals can contact their local health department or local pharmacy. Individuals are also welcome to return to the HOC to receive that second dose. We also attempt to make follow-up calls to remind individuals to schedule a second dose. House of Correction staff and residents are not required to get the vaccine. However, the CDC recommends everyone who's eligible to get vaccinated as a way to prevent the spread of COVID-19. Therefore, Milwaukee County is aiming to make it as easy as possible for our staff and residents to get vaccinated. Thank you, and I'll hand it back over to Catherine.
Thank you, Superintendent Jewell. We will now move into the media Q&A portion of our briefing. And our first few questions come from Sharon Bajenda with CBS 58. Her first question is, Dr. Anthony Fauci says the CDC may loosen restrictions even further as 7-day average cases continue to decline in the US. Any idea of what that may entail? Are we ready for more loosening of guidelines? And what are we seeing on a local level with case numbers?
So, I mean, it's hard to predict what a loosening of guidelines would be. I think certainly we saw some expansion of guidelines recently with outdoor events in particular, as Health Officer Rausch discussed. I think if we saw further expansion of opportunities, I think it would probably be more for vaccinated people. And that's because we continue to have more and more good news on the vaccine, good news on how safe the vaccines are, very promising news on how effective the vaccines are. A lot of the studies show they're even more effective than they were in the trials when they were first studied. And then the longevity of the vaccine as well. Every time we go further out from the people who initially were in the trials, 3 months and now 6 months, and continuing to look, the vaccine remains effective. One of the big questions is still whether you can transmit virus after you've been vaccinated. The studies that are starting to come out one by one have been really encouraging and showing that it's likely that you are far less likely to transmit the virus after being vaccinated. So I think that's probably the direction that we'll see in the future with expanded guidelines.
Sharon's next question is, one study in the UK is suggesting that if you have swollen lymph nodes after you get the COVID-19 vaccine, you may have already had the virus. What are your thoughts on this?
I haven't had a chance to look at that study and have to review it and take a look. And also important for it to go through the peer review process.
All right, the next questions are from Brittany Lewis with CBS 58. She asks, Mayor Barrett, do you think bringing the vaccine to the Bucs game this weekend will actually be effective? Do you think people will take advantage of it?
Well, I think it's a good shot. And what I mean by that is I think that it certainly is consistent with our effort to bring the vaccinations to the people. I wouldn't be surprised if a relatively high percentage of people who are attending the Bucs games have already received the shot, but not everyone. I mean, if you have people who are older, what we're seeing are that the numbers are higher. But those in the 20 to 30-year-old range or 20 to 40-year-old range, the numbers aren't as high. And I wouldn't be surprised if a significant number of people who are attending the game are in that 20 to 40 age range. So again, what we're trying to do is work with any willing partners, whether they're churches or community groups or the sports teams. So I think it is certainly worth the effort. And we want it to be used a lot. If it doesn't, then we'll try something else. So we know there's a lot of trial and error in what we're doing, but we remain committed to trying to get the vaccination into the community.
Our next question is from Mary Jo Ola with TMJ4. She says, DHS says the rate of vaccines spoiled and wasted is 0.10%. What is the rate in Milwaukee County? How are vaccinators working to keep the number of spoiled vaccines down?
I don't have the rate in front of me of what the spoilage is in Milwaukee County. If you're talking specifically about the Milwaukee County vaccination site at Kosciuszko Community Center, it's been extremely low. I think I don't have it right in front of me. I think in over 15,000 doses, there's been one dose that was wasted, and that was actually just in recent days. I do think there's a little bit, and not to put you on the spot, I think Health Officer Roush may have more insight on this than I do, but I think that we're entering a little bit of a transition period here with vaccines. So if we went 2 months ago, when we had extra vaccines at the end of the day, we had a long list of people that we could call, and we could go outside and find a long list of people who wanted the vaccine. It's getting more challenging now. We've seen more barriers to people traveling to get the vaccine. We've seen that we're starting to get toward people who are hesitant to get the vaccine. And so it's harder. It's becoming much more challenging for vaccination sites to ensure that you use every single dose. And I think we'll watch for local guidance, we'll watch for state guidance on what to do when you have a vial of 6 vaccines and you have 4 people who are knocking at your door asking to get it. You certainly don't want to turn those 4 people away.
And Catherine, I would add, if I'm reading that number correctly, the question is stating that 1 out of every 1,000 vaccinations is wasted. And as Dr. Weston said, we're beyond the period where people were standing in line for it. And so I don't want to see any wasted, but I don't think a lot of people would be alarmed when we have an adequate supply to learn that 1 out of 1,000 vaccinations are being wasted. Again, I don't want to see any, but 1 out of 1,000, we could be doing a lot worse than that, quite honestly.
Yeah, and I'll certainly agree with everything the mayor and Dr. Weston said. Just some more local data from the Greenfield Health Department clinics and clinics that we've run in cooperation with our partners at the Milwaukee Sports Complex. I think we've wasted less than a handful of doses and we've given close to 9,000 vaccines. So wastage is a very small number. We just don't have that number countywide, but certainly all of the realities of 4 people standing there for a 6-dose vial means there are complications in getting rid of those last few doses, but we've done a really, really good job in the settings that Dr. Weston and I are referring to of minimizing that wastage.
Our next few questions are from Joyce Garbasiak and Kent Wainscott with WISN 12, and they're similar, so I'll ask them together. Do you have any concerns about State Fair's decision to hold the fair at full capacity? And will the fair's decision to have any impact on the guidance for other large festivals and events in the city this summer?
So a lot of State Fair, it takes place outdoors, and we know it's a safer activity when you're outdoors. There are parts of the fair, obviously, that are indoors, and I think they're working with their local health departments to ensure that they have a safe process for mitigating any sort of risk.
Excellent. The next question is from Brittany Lewis with CBS 58, and it's for Dr. Weston. Do you know how many people received the Johnson & Johnson vaccine at the Kosciuszko Community Center site yesterday? And are you able to tell, based off of those numbers, if there is more hesitancy with the Johnson & Johnson vaccine following the pause?
Yeah, I don't have those exact numbers in front of me. I know we do offer Moderna and Johnson & Johnson at Kosciuszko Community Center. This is the last week that we're going to offer Moderna for first doses. We will transition over to just Johnson & Johnson for first doses starting next week. Obviously, we'll continue to honor all the second doses of Moderna moving forward. But we did have quite a few people that specifically wanted Johnson & Johnson yesterday. But we'll look at a few days worth of data to try to understand how those trends, how those desires are shifting.
The next question is for Dr. Weston from Courtney Sisk with WISN 12. Dr. Weston, you said most patients who show vaccine hesitancy say they are concerned with long-term effects of the vaccine. What other concerns do they say make them hesitant?
Yeah, I can't say that's necessarily most, but I do hear quite a bit from people who are hesitant about the vaccine about that. I think the other area that I hear about quite a bit is that people are worried, maybe two other areas. One is people are worried that it's going to exacerbate their chronic medical condition. They'll say, I have really bad asthma, I have heart disease, I have diabetes, and I'm worried that when I get the vaccine, I'm going to have side effects that are going to make my lung condition, my asthma act up, that are going to make my heart failure act up, things like that. So what I tell those patients is that the data shows, the facts are that the vaccine does not exacerbate your chronic conditions. And in fact, it's quite the opposite. The vaccine protects you because you have those chronic conditions. Since you have asthma, since you have heart failure, if you have diabetes, you're far more likely to get very sick with COVID. You're far more likely to be hospitalized with COVID. And ultimately, you're far more likely, unfortunately, to die of COVID. And so the vaccine is especially important in people with these sort of chronic medical conditions. The other question that I get quite a bit, the other one that I get quite a bit is that people are worried that they're going to be sick the day after getting the vaccine and they're not going to be able to go into work and are they able to take a day off and things like that. I think it's a reasonable concern. We know that a certain percent of people feel crummy for 24 hours or so after getting the vaccine. It's less common than people who feel fine. I got a bit of arm soreness. That's the most common thing. Most people just have that and don't get sick. But a number of people do feel under the weather for 24 hours. But I think you have to do two things. One is ideally, if you are able to, you can plan that into when you get the vaccine. Try to get it on a day where you don't have to work the next day. Get it on a Friday if you're off Saturday, things like that. And then I think the other thing to remember is you have to take it on balance. This is that risk-benefit conversation. You may feel crummy for 24 hours after getting the vaccine. Nobody wants to feel crummy, but it's a short period. It means the vaccine is working and it means you're gaining that immunity. But talk to people who've had COVID. Ask them how long they were sick for. You'll hear people who were sick for 7 days. You'll hear people who were sick for 2 weeks. You'll hear people who had it 3-4 months ago and are still feeling bad from it. So you have to take those two things on balance, I think. And that's what I tell patients who ask me.
Our next question is from Brittany Lewis with CBS 58. She says, Mayor Barrett, 3 Milwaukee public schools will return to virtual learning due to COVID-19 cases. What concerns do you have when you see that?
I have not been briefed on that either by the schools or by our health department, but if they're following the science, that's exactly what was intended. If there are outbreaks, that there are specific steps to be taken. And I assume that the schools have noted outbreaks and are following the rules. So I think it's working exactly how it was intended to work.
All righty. And then the follow-up question from Joyce Garbaciak is just related to the state fair for Mayor Barrett, if you're able to comment on that decision to move forward.
Well, again, that's located in West Allis. And so I assume that they've been working with the West Allis Health Department. I think that there's several months between now and the first week of August. I think everyone on this call shares my belief or my hope that we will be at much lower numbers then. But if we're not at lower numbers then, I think a lot of people will act accordingly. And people are acting in ways that are protecting their own health. And if they feel they're putting their health at risk, they're not going to go. So that certainly is my hope and my expectation.
The final question that I'm seeing now is from Courtney Sisk with WISN 12. She's asking Mayor Barrett and Director Rausch, what is your message to those in the community who are still hesitant to receive the vaccine?
Well, I can tell you my message is do it for yourself, do it for the people you love, and do it for our community. All you have to do is look at the humanitarian disaster we are witnessing in India, to understand how fortunate we are in the United States to have the supply of vaccines that we have. I don't want to see anything like what we're witnessing in India happen here in the United States. And so this is not just about you, it's about your loved ones, it's about your family, it's about our community. So please get vaccinated.
Absolutely, I would echo a lot of the same comments. Thanks, Mayor Barrett. It's one thing, and we've talked about it here on these briefings before, we know after the vaccine was approved, it was approved on a set number of people through a research protocol. And there were people, as Dr. Weston and I have talked about before, who were just chomping at the bit and wanted to get vaccine. And there were others who wanted to take a wait and see approach. And I think at this point, the wait and see approach has come to roost. We have to understand that there have been millions and millions and millions of vaccine doses given. The vaccine was proved to be safe and effective in the research trials. And furthermore, the vaccine has proven to be safe and effective and providing long-lasting immunity in real life settings, especially now with new COVID variants that have been coming out. So as Mayor Barrett said, getting it for you, getting the vaccine for you, getting the vaccine to protect your family, getting the vaccine to protect your coworkers, and to keep your community safe. We need vaccination levels to continue to increase so that we can continue to open and we can continue to get back to normal.
All right, I guess one final question from Madeline Anderson as relates to State Fair. As State Fair is returning in August, do you think it's safe for people to attend? What specific precautions should be implemented, and should admission be based on vaccination status?
Go ahead,
Sorry,
Dr. I'll let you jump in there.
I can jump in. That's fine. I would agree with what has been said already. I think that the State Fair, I believe, I have to catch up. I believe it's a few months off. I believe our numbers will be quite different than that. I hope our vaccination rates will be much higher than that. I think we'll have more guidance from the CDC at that point on what vaccinated people and unvaccinated people, for that matter, can and can't do. I think particularly for vaccinated people, we'll see their ability to engage in all the stuff we used to engage in getting wider and wider and wider as we continue to have good news on the vaccine.
All right, thank you all. Those are the questions for today's briefing. Thank you all for attending. Thank you, media, for the questions, and we'll see you next week.